Assalamualaikum and good morning. I bid to the fellow judges and friends. My name is Suhaila and I am with my research partner Muhammad Safwan. We are going to present to you our research entitled Oral Cancer Awareness and Knowledge Among Dental Patients Attending UiTM Dental Clinics. What is oral cancer? Oral cancer is defined as malignant neoplasm arising from the mucosal epithelium of the oral cavity. Oral cancer is a significant public health burden which ranks the sixth most common cancer worldwide. Oral squamous cell carcinoma represents the most common cancer of the oral cavity. Various risk factors are associated with oral cancer, but the main established risk factors are smoking, excessive alcohol consumption, and also bitter quick chewing. Oral cancer may appear as a white or red patch, a growth, or a persistent non-healing ulcer of more than 2 weeks. The majority of oral cancer were diagnosed at the late stage, which cancer has already spread to the lymph nodes. Mouth self-examination can be done to detect any precancerous lesion or early signs of oral cancer. Hence, awareness and knowledge regarding the risk factors and early signs of oral cancer among the public is vital to prevent delay in diagnosis and treatment. So, the two main objectives of our research are, first, to evaluate the awareness of oral cancer among dental patients. Second, to determine the knowledge of the signs, symptoms, and the risk factors of oral cancer among dental patients. Dear panels, now I will explain the research methodology. This is our flowchart of the methodology. This study was conducted after ethics approval by screening based on the specified inclusion and exclusion criteria. All patients aged 18 years old and above were randomly recruited. Meanwhile, patients diagnosed with oral cancer, mentally disabled patients, and young patients less than 18 years old were excluded from this study. Next, a set of validated questionnaires was distributed among the patients attending Faculty of Dentistry UiTM Sungai Buloh. The questionnaire comprises 3 sections, which are socio-demographic data, assessment of the risk habit, assessment of awareness, and knowledge on the risk factors and early signs of oral cancer. After that, the data were collected and analyzed using SPSS version 26. Here is the peak of our presentation, where our result shows 91% of dental patients aware of oral cancer, while 9% of them didn't. There is a statistically significant association between awareness of oral cancer related to educational level and family income shown by this table, which p-values showed 0.02 and 0.028 respectively. Now, I will pass this presentation to my partner to discuss and elaborate more regarding the knowledge on early signs of oral cancer and the risk factors of oral cancer among dental patients.
Thank you, Suhaila, for a tremendous and excellent explanation of the first part of our poster presentation. Now, allow me to proceed with the second part of the presentation by bringing attention to this bar chart. This chart shows us the dental patient's knowledge regarding risk factors of oral cancer, which are smoking, drinking alcohol, chewing bitter quid, and exposure to UV ray. The majority of them recognize that smoking is one of the risk factors of oral cancer. However, some patients didn't know that drinking alcohol, chewing bitter quid, and excessive exposure to UV ray could contribute to the development of oral cancer. We will now move on to the following table. Here, we can see that the smoking status of a dental patient is statistically significant with their knowledge of early signs, which is a non-healing ulcer within 2 weeks with a p-value of 0.004. Furthermore, only a few patients, approximately 72% of them with an awareness of oral cancer, know about mouth self-examination as one of the preventive steps of oral cancer. Let's take a look at what we can discuss from this study. There is a strong association shown by the educational level and family income per month with oral cancer awareness. This suggests that due to their accessibility to better facilities and gadgets, they benefit from social media, which then helps them being informed and educated regarding oral cancer. Our data demonstrate comprehensive agreement on smoking as the risk factor, but less recognition on excessive alcohol consumption, little quick chewing, and excessive exposure to UV ray. This may be due to the familiarity with tobacco's danger as frequently advertised by the government through media compared to other risk factors. Although oral cancer awareness was high among smokers, but their perception of risk factors and early signs of oral cancer was relatively low. The conclusion that we can draw from all the information we gain from this study is that oral cancer awareness among dental patients was high, mainly in patients with university backgrounds and higher family income. Despite the excellent understanding of oral cancer, there was still lack of knowledge regarding risk factors, early signs and symptoms, and mouth self-examination as a preventive step. Oral cancer awareness can be improved by providing information on oral cancer to the targeted focus group. Now, we have reached the final part of this presentation. What we can recommend from our study is that clinicians and dental students should have educate their patients regarding risk factors, early signs of oral cancer, and self-mouth examination, especially those who practice the risk habits. Oral cancer detection should be included in the curriculum for final year dental students to help provide them with the skills they need in order to perform oral cancer screenings on their patients later on. That actually brings me to the end of our presentation. Thank you very much for your time and attention.